Okay, let's kick off this deep dive. Here's something you might not know. Ringworm. It isn't actually a worm at all.
Right.
It's a fungal infection, but it's still a massive global health challenge, especially in tropical regions.
It really is.
So today, we're going to unpack what ringworm is, why it seems to be spreading so fast, and what you really need to know to stay informed and hopefully protected.
And just to set the scene, the scale is, well, it's huge. We're talking more than 650 million people around the world right now with some kind of fungal skin infection.
650 million. Wow.
Yeah. And ringworm, or tinea, as doctors call it, makes up over half of those cases. This isn't just like a minor rash. It's a serious issue affecting quality of life, work.
Productivity.
Exactly. And it really strains healthcare, particularly in more vulnerable areas.
Okay, so that's a staggering number. If it's not a worm, what exactly is it and why is it so common?
Well, it's caused by fungi, specifically dermatophytes. And these things just, well, they love warm, humid conditions.
Yeah.
So they affect the skin, scalp, nails, feet, you name it. And that's why it's so prevalent in places like India, Southeast Asia, large parts of Africa, South America.
Yeah.
Basically, the tropics.
Right, the warm, damp places.
Precisely. And it's amazing how common it is there. I mean, in some communities, you see figures like up to 78% of people going to a dermatologist. They're going for tinea infections.
78%. That's incredible.
It is. Kids often get it on their scalp. For adults, it's more likely on the body, groin, feet, nails,
And what helps it spread?
Several things, really. Manual laborers, athletes are often at higher risk. Sharing personal stuff like towels or shoes is a big one.
Okay, like in locker rooms.
Exactly.
Yeah.
And then you got factors like, well, overcrowding, constant heat and moisture, and sometimes just basic hygiene challenges. They all play a part.
Okay, but here's where it gets really concerning, I think. This drug resistance issue.
Yes, that's the alarming part.
We're seeing new forms of ringworm emerging that don't respond to the usual treatments, like this specific one, Treophyton indotinae.
That's the one. It's multi-drug resistant. Originally identified in India, but now it's spreading.
Spreading where?
To other tropical countries, and even outside the tropics now. It's topped up in Europe, North America.
So this is a serious problem.
It's a crisis, honestly. The main drug we used, terbinafine, it used to work like over 80% of the time.
Okay.
Now, in some regions, it fails for more than half the patients with this new strain.
More than half.
Yes. Multi-drug resistant means just that the standard stuff, it just doesn't cut it anymore.
Right.
So people need longer treatments, stronger drugs, maybe combinations.
Which means more side effects, more cost.
Right. And sometimes even those don't work reliably. It really raises questions about, global health security.
That's genuinely worrying.
Yeah.
So what does this look like? If someone gets it, what are the symptoms? They vary a bit, right?
They do vary. You might see that classic red, itchy, kind of ring-shaped rash on the skin. That's where the name comes from, I suppose.
Right, even though it's not a worm.
Exactly. On the scalp, it can be more like flaky patches, maybe some hair loss. Nails can get thick, discolored, brittle.
And feet. Athlete's foot is a type of ringworm, isn't it?
It is. Taenia pedis. So you'd see like peeling, cracked skin, usually between the toes. Itchy, sometimes painful.
And the impact is more than just the itch, right?
Oh, much more. Going to become chronic, hang around for ages. This leads to, feeling ashamed, self-conscious. People might miss work or school.
And secondary infections.
Yeah, if the skin barrier is broken from scratching, bacteria can get in. For adults especially, it's a real burden on their daily life, their productivity.
Okay, so bringing this back to you, listening. What can you actually do if you think you might have it?
Right. Well, first things first, don't just ignore it or try random stuff. For a simple local infection, those topical antifungal creams you can buy, like terbinafine, clotrimazole, ketoconazole, they often work if you use them properly for, say, 2 to 4 weeks. But if it's widespread or chronic, or if you're in an area where resistance is known, you really need to see a healthcare professional.
Why is that so important?
Because they might need to prescribe oral medicines, like itraconazole, especially for these resistant types, sometimes for longer courses or even combinations of drugs. And crucially, please, avoid self-medicating with whatever you find.
Why is that? Just makes it worse.
It can, but the bigger issue is it fuels drug resistance. Using the wrong drug or not using it long enough, that helps these resistant fungi thrive. Early, correct diagnosis and treatment is key.
Got it. And what about stopping it in the first place? Prevention.
Prevention is huge. Basic stuff, mostly. Keep your skin clean and dry. Change your clothes daily, especially socks and underwear. Wear loose, breathable fabrics like cotton, particularly in hot weather.
Makes sense.
And community education helps a lot, but also things you can do at home. Wash clothes, towels, bedding in hot water if possible, disinfect surfaces, and definitely don't share personal items, towels, shoes, combs, that kind of thing.
So, wrapping this up, what's the main takeaway here?
Well, I think it's clear ringworm is, it's way more than just a simple itch. It's almost like a hidden epidemic in many parts of the world, especially the tropics, and it really needs more attention.
Definitely needs attention.
But the good news is, with awareness, good hygiene practices, and importantly, smart medical management getting the right diagnosis and treatment, we can control its spread and lessen its impact. Your skin really is your shield, you know. Understanding these challenges is the first step to taking care of it.
And recognizing how connected global health is. A resistant fungus in one place can and does travel.
Absolutely. It shows we're all kind of in this together.